All right, welcome everyone. Nice big group we have in here. Welcome to the Data for Doers, affectionately named by Sherry Brown. Thank you, Sherry. We're using it the next place we go to. My name's Karen Henshaw. I am with the Connections in Health team, and we're going to take about the first half hour or so to talk a little bit about the project, what we heard when we had conversations with people in the community. And then we're going to turn it over to community partners to share about their projects and their groups and what they're working on. Some of those folks have joined us online. I think it looks like we have 17 people online and some folks are in the room. So we'll just go through the slides. We're having technical difficulties. So this one's actually connected to the Zoom, and that one's going to be the slides that you can see. So if you see Lindsay and I both advancing slides or something looks fun, it's funny, it's weird. We're going to make it work. It's all going to be cool. Okay. So everybody online able to hear okay?
You sound great.
Okay. All right. And I'll turn this volume up as high as I can. So when they start talking, hopefully you can hear them okay. So, all right. So we'll go ahead and go to the first slide here. Just wanted to give you a little bit of background about Connections in Health. It's based in Indianapolis on the IU School of Medicine, IUPUI campus inside the IU School of Medicine, and it's a part of Indiana Clinical and Translational Sciences Institute. There's a lot of layers there. There's no quiz. You're not going to have to remember all that, but like to share so that you can understand the connections that we're able to have across the state. And you can see, oh, Lindsay, can you go to the first one? You can see the different universities in the state that come together to work with all of us at Indiana CTSI. So we've got folks from Purdue, IU, and Notre Dame, and we all play just fine. There's a little competitiveness sometimes when sports are happening, but other than that, everybody really collaborates really well. There's lots of partners across the state that we have bi-directional partnerships with. We sometimes are asking them for help on a project. Sometimes they're asking us for help on a project. So lots of connections across the state and people that we get to work with. So it's a lot of fun. A little bit further, a little bit deeper then about Connections in Health specifically, we're a part of the Community Health Partnerships, which is the community engagement arm of Indiana Clinical Translational Sciences Institute. And everything inside that gold band is considered part of Connections in Health. So we have 3 statewide health coalitions that have been around for many years, and they just came under the umbrella of Connections in Health in 2018. And those coalitions are Hoosier Health and Wellness Alliance, which focuses a lot on nutrition and physical activity and food insecurity. Cardiovascular and Diabetes Coalition of Indiana, which focuses on cardiovascular disease, diabetes. Stroke is not in the name, but there's also a focus there. And then the Indiana Joint Asthma Coalition that focuses on asthma. The 4th piece then says cancer control, prevention, and equity. And that is a position that's going to be a liaison between IU Simon Comprehensive Cancer Center and the Connections in Health team. So that person will be able to sit on both teams. And hopefully we'll have someone hired for that in the next month. We're doing final interviews, I hope, in 2 weeks. So that person will be able to kind of sit on both teams and then come out to the communities. And if there's something related to cancer that the community wants to work on, we'll have that resource as well with the Cancer Center. So together, we all are hoping to have a positive impact on the health outcomes across Indiana. So the whole state is what we want to cover. We have a pretty small team. We have a mighty team, but we have a pretty small team. And so instead of trying to focus on 92 counties all at once, our team has decided to take an approach of 1 county at a time. And so a lot of data was put together. Looking at social determinants of health, county health rankings, life expectancy, all the chronic disease areas that our initiatives focus on. Counties were ranked, and then we talked to our partners, Purdue Extension, who are in the communities, our funders at the Department of Health, leadership at Indiana CTSI, and then our partners at the Cancer Center, and ask, where should we go? Of these counties that look like they have the most opportunity, who should we talk to first and where should we go? So from that,
Did it overheat?
the projector just went off in the room. We're going to keep going. You're not going to be able to see this, but we'll share these with you. Let me do this. Look at the tiny screen, everyone. Anyway, we have this map over here of the first 10 counties that we're going to engage with. We started with Grant County and Vermilion County. Blackford County is our third county. So this is still very new. It's a very new project. And what we want to do is come into the county, talk to people, listen to people, have conversations, find out what's important to you related to health. What do you think are some major successes? And what do you think are some major challenges? And then how can we help you with some of those challenges? How can we help provide resources or networking connections with experts from our coalitions? We have some funding that has been shared with the community. So, what can we do to help you address the challenges that you want to address, that you think are the most important? Okay. I know you can't see that, but we're going to share all of these slides, and we're also going to share the videos with everybody that's registered. So you'll have an opportunity to click through them at your leisure if you want to. So this is our map, and this was as of July. So we're getting ready to launch a new membership inquiry in January, and it will, I'm sure, look different. But so far we have 132 unique members, meaning we have some people that are members of more than one of our coalitions, and representing 84 of the 92 counties. So pretty far reach. The reason I mention that is because this group may say, oh, we really need to work on this challenge, this health challenge. And we may say, hey, we know somebody in Elkhart who's already been working on something like that. Why don't we get you guys together and see if there are resources that you can share, things you can learn from them, or that type of networking. So that's why I share that. We've got connections all over the place that are lots of really valuable members of our coalitions. Okay, I'm going to turn it over to Aaron. He is going to talk about some data, and he's on Zoom. So yeah, I'll turn up the volume as I can.
Can you hear me okay?
I think so.
Okay, I will try to be as loud as I can possibly be, and I'm assuming we don't have slides still, so I'm going to try to be as descriptive as I can possibly be as well. So, in talking with the community, we have certain focuses within the coalitions that we can focus on, primarily the chronic health issues that Karen mentioned earlier. When I'm thinking about a community, it's pretty good to get kind of a baseline, where does Blackford County stand as compared to Indiana? So with some of those chronic health conditions, kind of, paint a picture before we start to talk about, what we heard, but and I'll talk about a couple of outcomes and how Blackford compares to Indiana. So with heart disease, Blackford County has a higher incidence than Indiana as a whole, among male and female. So it's about 241 cases per 100,000 residents, compared to Indiana is 213. So about a 10% higher heart disease incidence among men in Blackford County than Indiana. Diabetes prevalence, it's 15% in Blackford, 11% in Indiana. So it's 4% higher there. Stroke is actually higher in Indiana as a whole than it is in Blackford. So that is one area where Blackford is not higher. Asthma is about the same amongst Blackford County residents and Indiana residents. It's 10%, and that's a pretty consistent measure that we see across most of Indiana. Some areas are higher in more urban areas with incidence. Lung cancer and breast cancer are both slightly higher in Blackford County. Lung cancer in men is about 91.7 incidences per 100,000, whereas Indiana is 86.5, so about a 6-7% increase there. And then breast cancer is about the same, 29.6 in women as compared to 26.7 cases per 100,000 for Indiana. And then lastly, kind of focusing on some of these other nutrition focused and exercise focused initiatives. Physical inactivity. 31% of Blackford residents are physically inactive as compared to 27% of Indiana. That's about a 4% difference. Food insecurity, it's pretty consistent. About 14% of residents are food insecure in both Blackford and Indiana overall. About 5% higher rates of obesity in Blackford, and then access to exercise opportunities. About 60% of folks have adequate access to exercise in Blackford as compared to 77% in Indiana overall. We can go to the next slide here, Karen, but it just want to emphasize that these are not necessarily bad things, but it's things that we can work towards, right? These are areas of improvement that, we want to utilize the resources that we can provide to start working towards improving some of these outcomes. So kind of getting into what we did, we heard a lot. We got to talk to a lot of people, as well as we also had a survey that we did prior to listening sessions. So we had 36 people who talked to us in those listening sessions. I'm sure many of you are the folks that we talked to. As well as 78 people who completed the interest survey, which asked many of the same questions about which areas would be, who's working in areas of these chronic disease coalitions, what are you seeing in the community already, and who else should we talk to? So again, 36 people in listening sessions and 78 who did the survey. So one of the things we like to put emphasis on is who are we talking to and understanding where they come from. So if you want to go to the next slide, Karen. We talk a little bit about sectors. So for us, these are just variety of areas where folks work. So it could be healthcare systems, it could be local government, it could be educational systems, schools, a variety of different things. But we saw a lot of the conversations we had came from community members, folks who didn't necessarily identify with local government or community-based organizations, but a lot of community members we talked to. The next highest was community-based organizations and educational systems and local government. And then there was also healthcare systems, military, businesses, and a couple of statewide organizations. But yeah, we heard from a lot of community members. And so one of the things we want to highlight are, what are some of the successes that all these folks said were in Blackford County as related to these chronic disease areas. So if we go to the next slide, I'll go through these chronic disease areas and talk about what folks talk about. We want to give that back to you so you can understand what people think Blackford County is doing well. And I'll try to read all of these so that you guys don't have to worry too much about the slides. But when it comes to cancer, they said that Blackford County Concerned Citizens Group was a great advocate for cancer improvements in the community. There were a lot of grassroots movements for cancer within the community, as well as Blackford County Cancer Support. And then the next slide is the diabetes, heart disease, and stroke as related to CADI. We heard that the Dining with Diabetes program has been a success. Taylor University's Invitation Center has emphasized helping residents address chronic health issues, and this spans across more than just this one, but they specifically mentioned diabetes. And then again, collaborating with CADI, there will be health fairs in the fall. And on to the next one is nutrition. Implementation of mini gardens across both Hartford and Montpelier. Youth food curriculum that uses the My Plate model. New food sustainability project. Access to fresh fruits and vegetables through community and family services. We heard time and time again about the food pantries in the community and all of the efforts that they're putting in, which were major successes. More funding opportunities for community nutrition initiatives, as well as a greater awareness on how to prepare food in ways that are nutritious and how to have access to more nutritious foods. Next is physical activity. Some of the things we heard were Purdue Extension starting a walking program, the Blackford County Greenway Project and Nature Trail. There's a major focus on youth and adult sports programs. There we go, thank you. The Hartford City Health Club. And then also talking about the Hartford City Skate Park and grants that they've received to improve the parks throughout the whole county. Next is tobacco. We had a lot of folks who talked specifically about tobacco. We crossed that with the Cancer Initiative and Asthma Initiative. But the Tobacco Coalition within the community is great. Implementation of tobacco-free zones, outreach for tobacco cessation, as well as IU Health's involvement with cessation programs. And then lastly, there were a couple of other successes that didn't quite fall into any of these, specific chronic health conditions. But some other things we wanted to highlight is that churches have done a great job of implementing programs to assist folks in opioid use treatment. There's a strong focus with cleaning up downtown areas, as well as opening a federally qualified health center in Hartford City as a future goal. And then these last two slides, I just kind of want to show you visually. So again, I'll try to describe it a little bit. But between the listening sessions and the surveys that we saw, we wanted to make sure we kind of visualized, what folks were actually saying the most challenges were. So those were the successes, but where are we having some challenges and what areas can we focus more on? So the top three here identified in the listening session are nutrition with 23, diabetes with 22, and cancer with 21. So of those listening sessions, 23 of the 36 mentioned that nutrition was an area of a lot of challenge, and then so on. So again, listening session said nutrition was the highest, with diabetes as the second highest and cancer as the third highest. And then the next slide, which shows the interest surveys, we see, which is of 78, I believe is what I said. Cancer is listed as the highest, with diabetes listed as second highest, and physical activity and nutrition are very close there, as well as cardiovascular disease for that third spot. So a lot of consistency across these two. Cancer shines here as the kind of the top target for interest surveys, and in the listening sessions, nutrition was the top. That's kind of just a little overview of what we've heard, what we've seen. I'm going to pass it over to Karen to finish off talking about what these challenges were, and then happy to answer any questions if there are.
Thank you, Aaron. So this word cloud is, it shows all of the challenges that were mentioned. And when we ask for more information, tell us more about that. These are the types of things that people talk to us about. So if you're not familiar with word cloud, the larger the word or phrase, the more times it was mentioned. So you can see, I'm going to say heart disease and health education are smaller. They were mentioned fewer times than, say, smoking and vaping, cancer, and poverty. Poverty was mentioned the most of all of the challenges that we talked about. So same information. This just has the challenges related to the chronic disease areas that Connections and Health focuses on. So we filtered out some of them that we don't really have the experts in our coalitions to help with those. And then you can see here that physical activity opportunities, not physically active, and physical activity costs are all up there. So in the next slide, what I did was I grouped together the ones that were similar, and all three of those show up as physical activity. So nutrition went together, anything related to nutrition, anything related to physical activity. So here's the top ones related to top challenges or concerns in the community related to the focus areas that Connections and Health already focuses on. So nutrition and physical activity were at the top. Cancer was real close. Smoking and vaping was not very far. Obesity, diabetes, heart disease, and health education are also there. And I know it's tiny at the bottom, but you will have this after the fact so that you can remember what was grouped into these categories. The physical activity does include mentions of not having opportunities for physical activity, just not being physically active, or that it being too costly. Not everyone could afford it. Nutrition included any mention of food deserts, knowing how to cook healthy unhealthy fast food options, and the need for nutrition education. So maybe people aren't even aware of what they should be putting in their bodies. Cancer included several mentions of unhealthy environment. So there were a lot of people that mentioned some type of unhealthy environment. Health education references education about their chronic disease. So maybe I'm diagnosed with diabetes, but I really don't know what that means or what to do with that information. So now what do I do? So there were several mentions of people having that diagnosis, but not really knowing what it means or what to do with it. So from here, and I know you can't read these, don't hate me for that. This is a PowerPoint 101, do not do this, but I wanted you to have it. So when you get these slides, you can look at these, but these were the specific challenges or mentions that people gave us when we said, tell us more about that. So it's things like people have to go to Muncie or Marion for certain services. There aren't enough doctors to serve our population. City residents are not very physically active. Heart disease is still prevalent in the community, and we have a lot of low paying jobs. So it's very specific, detailed information. And what our plan is, once you hear from the groups that are working in these areas, our plan is to join those groups if we haven't already, come alongside them, and we're going to share more details. So if there's a group specifically focused on diabetes, then we want to share more of the information in detail with that group. So there's a lot more information and data that we have. We're just kind of giving you a broad overview today. And our hope is that when you listen to the different groups that are addressing these challenges in the community, that you'll get involved. There'll be something that trips your trigger and you say, I want to get involved with that. I want to help with that. That either aligns with my job or that aligns with my passion. I know somebody, or I'm personally invested in helping to address this challenge. So that's our hope for today. So whichever group that you decide to join, you may get a whole lot more data points and specifics from us at a later date when we start sharing more information with those groups. I think that's the end of this. Let me look. Yep. Okay. So does anybody have any questions about what we did? What information you just heard about, what was collected, what we're sharing back to you? Okay. What we're going to do now then is we're going to go right into the presentations from our partners. And those of you who were here, was it last week? 2 weeks ago-ish, week and a half ago. Just push this arrow to go to the next slide. It's the arrow that points that way. Push this arrow to go to the slide, and we'll just cycle through all of the presents that are in line with the slide.
Thank
Okay.
you.
Okay.
Have fun. Only you would say that. There you go. I'm Eric Evans. I know quite a few of you folks are in here. I'm here on behalf of the Blackford County Concerned Citizens, of which I'm the president. We're a local group of people, and our focus has been for a number of years on the high incidence of cancer and neurological disease in Blackford County, specifically in Hartford City. We have been doing research and testing. When I say we've been very fortunate with Dr. Steiner, Terry Steiner from Purdue Fort Wayne, has assisted us with grants and other assets that the university is able to provide us. We've been successful in doing testing and things. Basically, what we have been trying to do for several years is to learn why there are so many cases of cancer and neurological like Lou Gehrig's disease and Parkinson's. Why we have those so much of that, such a high incidence in our city, in our county, and we've done testing based on early on, we thought that it could be because of in years past, there were a large number of glass factories in the area. And glass factories use a lot of lead and arsenic in their processing. And we thought perhaps that was the cause. We did testing in old glass factory sites, soil and water and air, and found out that although there was the presence of lead and arsenic and some other things, it was not at a level to be concerned about it. We worked with Dr. Indra Frank from Hoosier Environmental Council, thank you. We worked with her very closely. So as our next step then was to do some testing of air quality in a specific location that we knew had some contamination issues in the city. And again, we did some testing. It's relatively new. It was developed by the United States Forest Service out in Portland, Oregon. And it's kind of falls into a category called citizen science. And we shared this information. The results were from the testing in the laboratory. The results were that there were high instances of heavy metals in a particular area in the community. We then shared that information with IDEM, who's responsible to deal with issues like that. And IDEM said that our procedure was not correct in our experiment, our information gathering. So we went through the steps of doing it again to follow the procedure to the absolute letter that IDEM wanted us to do. We found some more results, but IDEM still didn't think that the citizen science was good enough. So after a lot of letter writing and contacting the governor and other places of high interest in the state, IDEM came in and did a series of tests of the air quality. Now, we shared with them ahead of time the protocol as it was followed in the Portland area, but they didn't follow that protocol that closely. Their results said, yes, there are incidents of chromium, lead, arsenic. There's that stuff in the air, but we don't think it's an actionable level. It's not anything that IDEM would take any action that they're allowed to take. So we really didn't agree with that. And we pointed out to them that they didn't really follow the guidelines and protocol correctly, but and we made those points very clear to them, but they basically gave us no response. So through some of the research that Dr. Steiner had done, she was able to contact some folks at Purdue, West Lafayette, that have looked into the issue of it's kind of I think myself it's kind of a funny name, but it's called a chemical soup. And it's okay, maybe the presence of one or more of these chemicals in the air or in the water, in the soil is not actionable. But what happens if there's more than one mixed together? What happens if there's 4 or 5, mixed together? And so Dr. Steiner's help, we have a grant from Trailblazer grant through Purdue. We're working with the 2 people at Purdue, and we are going to do some intensive testing to try to get some answers to this, to our concept of the chemical soup. And I'm going to turn that over to Dr. Steiner to tell a little bit more about that. And I'll answer any questions that you might have. But I think that this really fits well with the program that we're talking about here today as a whole, because we've already learned from, we attended one other meeting a week or so ago, and just from that, we've already started making some connections and sharing of information and sharing of ideas. And it's been very helpful. And I was, after hearing the first presentation and being part of it, I was really excited about, I think this is really going to be beneficial to everyone that lives in the county, because I think we're going to have a lot better chance of getting answers to the questions that we've been seeking for a long time.
This represents a shift with Blackford County Concerned Citizens on our collaboration away from governance and enforcement of the law toward public health, because the The legal levels of exposure are determined based on a healthy adult male, one chemical, one avenue of exposure. We're looking at residential exposure of low-level doses of multiple chemicals, the soup, but also multiple pathways of exposure, because we identified pollutants in soil, in water, and in air. And then looking to see if there might be a relationship with people's health. So there's 3 aims to the funding. One is to characterize the extent of environmental contamination and community members' exposure in the commercial Maine neighborhood. And then another is to conduct a comprehensive countywide health survey to determine if there might be a relationship between environmental contaminants and health outcomes. And then we're having a health questionnaire. We're soliciting input in January. If there's additional questions that you would like to have added to the health questionnaire before we finalize it. And that is going to be on January 22nd. 10:30 to 11:30. So please watch for the announcement of where that will be located. And then we're engaging the community to develop a neighborhood-specific public health action plan. A lot of the public health emphasis on stroke, diabetes, et cetera, focuses on individual behavior. One of the distinctive contributions we have is looking at the social context and environmental exposures. So this is the timeline for what we're looking at. In February, we update the questionnaire. You should be seeing us in the community all through spring and summer, and we hope to get enough data to start looking to see if there's any relationships in the fall. Joanna Bell is you may know Joanna, she's our local person on site who will be a contact person in the community.
Any questions? If anybody has any questions, we'll be happy to answer them. I have a commitment over in the courthouse at a little bit before 2 o'clock, as do a couple other distinguished gentlemen here. But I will come back over after that just to include and answer any questions you have. Dr. Steiner, who's really a lot more knowledgeable about this than I am, can answer any questions that you might have. And thank you very much for your time and your attention.
Hello, I'm Lindsay Cox. I work with Purdue Extension, Blackford County, and I'm going to talk to you for a couple minutes today about enhancing the value of public spaces, which is a workshop we are about to put on here in Blackford County in early 2022. Sherry has wanted to bring this to the county for a long time, and it's finally happening, and we're so excited. So Karen had mentioned the different coalitions under the Connections and Health umbrella, and one of those is the Hoosier Health and Wellness Alliance. So for about a year now, Sherry and I have joined their Parks Board Working Group, which is all about increasing Parks Board capacity in the state. So applied for a grant. Thank you, Antonia Sawyer, who leads that coalition. And Blackford County got money to implement this workshop. So early 2022, save the date. We don't have them marked yet, but we'll get a hold of you. So enhancing the value of public spaces is an asset-based approach. So we look at what we already have in terms of public spaces, parks, trails, buildings, sidewalks, all that sort of stuff. We look at what we've got and we look at it through different lenses. So they call it the capitals. So those are built, financial, political, social, human, cultural, and natural. So we'll look at what we have using those lenses. We will consider what we want with those spaces and what can we do to use them and to enhance their value. So we get to dream about what we want those spaces to look like and how we can use them. And we look at those through goals, reachable goals to get through this. So they call it a comprehensive process. So we aren't just dreaming big and we need $1 billion to achieve something. This is more actionable, doable goals to get to that. And then developing strategies on how to get there. So with enhancing the value of public spaces, we want everybody included. We want these spaces accessible for everybody. And what's really cool is that there's a Purdue team that this is what they do, and they're here to coach us through the whole process. And we will need everybody involved. We need all sorts of people from the community involved. This is not just for the elected officials. This is for everybody. And so not only that, but there will be workshops over a few months, and there will be a really big one. And then there's kind of smaller ones with more focused groups. And so if you're going to come to some of these, that doesn't mean you're going to come to all of them. You don't have to. However, we do need at least a few people to kind of be that core team of people who will go to all of the meetings. So Sherry and I will be in that, but we need other people too. It's not just us. So I think it was Putnam County. They recently went through this process. Does that sound right? Yes. And they found that their core team of people who went to all the stuff, it was about a 2-hour commitment every 3 weeks. And that went on for a few months. So that kind of gives us a roundabout idea. And so this idea is that what we develop from the workshop process can be used in other things, like creating a Parks and Rec strategic plan that we will then submit to the Indiana Department of Natural Resources. And then they approve it. And then we're eligible for funding. And then we're up for doing the county comprehensive plan that needs updated. So what we come up from with this can be used in that plan. And then you can also use it, say you're doing a fundraising initiative, things like that can be used from this workshop. So we're really excited. We don't have dates set, but we need everybody to be involved. So we'd love to have you. So we'll get a hold of people when we have dates set and things like that. And my coworker, Jane Himmick, is here. I'm switching from EVPS right now, Enhancing the Value of Public Spaces. Jane Himmick is our Nutrition Education Program Advisor, and she's amazing. And she does free programming. So she can do programming, nutrition, physical activity sorts of programming for free with children, teenagers, adults. She can come to your group. She can set up lessons with folks. So I invite you to connect with Jane Himmick. I'm going to pass it over to Sherry.
Thank you, Lindsay. I always hate following her because she does such a great job and gives us really good information. You're a good community cheerleader, Lindsay. Just a couple of things. One of them is when she talked about the capitals, social capital is one of them. And we decided, I got together with a few people, and we're going to take a look, hopefully coming mid-January. We're going to invite people to join us. Again, I know there's a lot of group stuff going on, but invite people to join us and get together. We're going to take kind of an asset-based approach to what do we have here in social capital in the community? What do people care enough about that they would invest their time, their talent, that type of thing to help initiate some positive change or continue some positive change? Amanda's sitting right here in the front row. She is an extraordinary volunteer from 4-H. The hours that you put in 4-H, that's what we're talking about, is what do we have in that kind of capital? What do people really care about that they'll get involved in? And how, if we came together collectively, could we further those efforts? So you'll be hearing more about that. We had a name, but we've changed a little bit. So not sure what we're going to call it. We were going to call it Bridge to Hope, but it may be called something else as we move forward. But we just really are going to take a snapshot of the assets and the things that we have in the community. So it's along the lines of enhancing the value of public space. Is probably a precursor to that. That's a piece of it, but that's not all of it, because it'll be more about personal talents and things. So we'll get you more information on that. Something else that you're hearing a lot of, Sherry mentioned it, probably once a week, we have an opportunity right now to either take a survey. Last time we met, I sent something out, ask people to write a letter. Lots of that stuff is coming down the pike. It's vital. It is really, really, really important. When you see something like that, would you please take this survey? Those aren't documents. That's not data that's collected and then put on a shelf somewhere. That's being used. It's being used in multiple ways. Sometimes Sherry may collect it over here for something, and then we may be able to take that and use it towards some grant funding somewhere else. So all of those things, when people weigh in, are really important. We did a broadband survey a while back, and the data we got back, Purdue was very, very impressed because their numbers were high. which is exciting. We have citizens engaged, people know. So get the word out when you see those things coming out. We're not just asking so we can check off a box. We're asking because we're really going to put that information to use and probably in multiple ways. So we thank y'all for that, because I know it's a lot and a lot coming at you, but when you take the time to get involved, it really does matter. Oh, and sorry, come on up, Karen, but December 23rd, speaking of social health, December 23rd, we'll be having our Christmas parade. So more information to come on that too. You'll be able to pick up luminaries. We're going to encourage everybody in Hartford City to help us light up the night by grabbing a free luminary at mayor's office or at our office, putting those out. Even if you can't decorate with lights and things outside, not everyone can do that, but join us for the parade and help us light up the night.
Thank you. Okay, is Catherine on?
I am.
Awesome, it's your turn.
Okay, thanks. And thanks everybody for the opportunity today to talk a little bit about what it is that we are involved with. We have an initiative in both Blackford and Jay County right now, Consortium for Opioid Response and Engagement in East Central Indiana. And we affectionately refer to it as the Core ECI project. And again, it is crossing efforts in both Jay and Blackford counties right now. Now, the next slide, please. So the Core ECI actually is very multi-sectorial. It's a coalition of organizations that are mostly local, that are fighting alcohol and drug addictions, or opioid and substance use disorder in Blackford and Jay counties. And it's a 3-year initiative that was started this past September, and it's funded by the United States Department of Health and Human Services, Health Resource and Services Administration, or HRSA, the Reagan Street Center for Healthcare Engineering at Purdue, and its partners in the Core ECI coalition group are working together with many community stakeholders that are focused on trying to strengthen and expand local substance use disorder prevention, treatment, and recovery. Next slide, please. And on this slide, what you can see, and I'm not sure how big the slides are, I hope you can see them. And again, it's always a risk to put a wealth of information on one slide, but in the center, you can see that we are representative there of the consortium, and the consortium groups that participate actively in the leadership, as well as the writing of the funding that we received, are IU Health Blackford and Jay Hospitals, both, A Better Life Brianna's Hope, the Jay County Drug Prevention Coalition, the Hester Hollis Concern Center, or better, I think, or more recently referred to commonly as the Blackford Grant Mental Health Group, and as well as the Blackford County Community Corrections and Purdue University and Purdue Extension. So this group in total reflects the Core ECI partner group. And off of each of those circles, what you see are other, I hesitate to use spike really in this day and age around a circle, because now we all think of what the coronavirus is representative of. But notwithstanding, the spikes really represent other community stakeholders that have been identified by each of the Core ECI partners. So as we started with the Core ECI partners, each of them identified other folks in the community that they felt it was critical for us to talk with. And over then the next few months, or this very first quarter of the grant, we have been reaching out and having multitudes of community meetings, with one-on-one meetings with law enforcement, judicial community, mental health community, physician community, faith leaders community, recovery groups, recovery support groups, recovery ministries, extension groups, So we have reached out then to all of those groups. And what we have done is try to continue to identify those strategic partners, those partners of interest and critical support with throughout the community. And as we have come through this first quarter, we have been doing that on a very continual and active basis. Next slide, please. So that really has led us to solidify what we are talking about in terms of our core ECI goals. And those core ECI goals, and they're listed or they're enumerated on this slide here, but just to call them out, to build a sustainable consortium of stakeholders that are in a position to combat substance and opioid use disorder going forward, to interrupt the intergenerational cycle of addiction through early intervention. And this has been identified and highlighted in almost every segment of the community that we've spoken to, and is the intergenerational cycle of addiction that has been prevalent, and the desire to try to intervene at the earliest of ages in that regard, to embed evidence-based prevention, treatment, and recovery services into a seamless community-based system. So we're very much concerned by the identified gaps in what we call either soft handoffs or transitions of care between a variety of different treatment recovery services in the community. Are they there? Are they not there? And if so, how do those handoffs occur to enable success for those that are participating? And increasing access to medication-assisted therapy for opioid addiction across several different platforms are really areas of focus. Our timeline, given a 3-year approach, you'll see on the next slide, please. So in year 1, we really are spending a lot of time gathering community input. As it relates to that community input, I think your community, I think the community as a whole is going to be likely very busy in January from what I'm hearing, with lots and lots of opportunities to create strengthening across Blackford County. Well, we're one of those groups that is also going to have a January event. We are planning what's called a strategic doing event on January 18th. Sometimes people refer to it maybe as a community planning event, but strategic doing is a structured evidence-based approach to identify assets and gaps in community services, and putting together multi-sectorial groups in prevention and treatment and recovery areas of focus. We will, in strategic doing, identify gaps and very actionable items that will guide the process throughout the first year, or the remaining part of the first year. And then it'll be reassessed again as we move into the early part of year 2. So and by year 3, our goal is to have identified and developed and enabled a very strong local community guiding group of stakeholders such that this work is sustainable. So from Purdue's aspect, where Purdue is guiding and leading this first year of identification of strengths and assets and issues to be then prioritized, and then to facilitate work on prioritized goal in year 2. The goal is for Purdue then to step back and be in more of a supportive role as stakeholders and leaders in year 3 continue to drive the work forward. And that has been demonstrated to be a much more sustainable model for growing and implementing community identified prevention, recovery, and treatment goals throughout the process. So that kind of is in a nutshell. in terms of what it is our projects identified and are working with the community. Community involvement, again, like so many efforts, is absolutely critical. The community investment in collaboration and leadership with your community stakeholders, as well as integration with Purdue, has the best chance for success is what moving forward. And I think on the last slide, I don't know that we are embedding time for questions at this point, but certainly you are, please feel free to reach out to us at any point, particularly if you want to be involved and you don't know somebody that's already involved or a route for that involvement, please feel free to reach out to us. Thanks a lot.
Thank you. Susie, are you there?
Yes, I am here. Can you hear me?
Yes, we can.
Okay, great. I would also like to say thank you for the opportunity to talk to you all today. My name is Susie Crow, and I'm a Global Health and Health Equity Fellow for Purdue University. I work with the Center of Health Equity and Innovation at Purdue, and we are basically an eclectic group made up of faculty from the College of Pharmacy, Agriculture, Engineering, Communications, and Public Health. Most recently, we've been in the news because Dr. Jerome Adams, the former U.S. Surgeon General, has been named as our Director of Health Equity Initiatives. And so we are very fortunate to have him on board. We are a fairly new group looking for opportunities to get involved in Blackford County and other rural counties of Indiana. I am also from a rural community in Southern Indiana, and so rural communities like Blackford County are near and dear to my heart. It is actually what brought me to Purdue in August to work with Chucky, whose mission is to address the needs of underserved populations, both locally and globally. This includes underserved populations within Indianapolis, but also includes underserved populations within communities, rural communities like Blackford County, Indiana. And so if you look at the slide off to the right, I hope you can also see it's kind of a busy diagram, but basically what our focus is on the social determinants of health, but specifically building innovative, sustainable models for community members in healthcare delivery, supporting contextualized care delivery for the community, integrating wellness content across the spectrum of education, assisting with income generation and opportunity creation, and then also delivery of and access to affordable and effective healthcare services. So we've gotten involved within West Lafayette and also in Indianapolis on projects involving food insecurity. I did notice that that was one of the community concerns, and so I wanted to put that out there. We're looking for opportunities to be more engaged and involved within the community. So if anybody's interested, please reach out to me and we can work together on some possible projects. Another way, next slide, please. Another way that Chucky has been involved in the past several months is in giving flu and COVID vaccines within Indianapolis mostly, but also with somewhat within West Lafayette. We've been working with food pantries to give vaccines while patients are waiting to receive food. We've also done both the drive-through and indoor models of the food pantries. We, of course, aren't in the business of pressuring people to get vaccinated, but we're trying to be out in the community, answer questions, and offer vaccines to anyone interested in getting it. As you can see from the slide, we've given about 584 vaccines. That was as of November. That number is up now as we've done a few events already in December. And all of these are free of charge to the patient. We've been giving most recently pediatric and adult doses, booster doses of the vaccines. And while we've mostly done these events within Indianapolis, we would love to offer a similar type of event within Blackford County, where we need a connection within Blackford County to make that happen. And so I just looked at Blackford County's vaccination rates today, and the community is about 42% fully vaccinated. And so there's a lot of room for improvement. And I also noticed there were about 14 new cases of COVID diagnosed within the past week. And so again, we're looking for opportunities, not, of course, to force people to get vaccinated, but to have a vaccine available for anyone that's interested in getting vaccinated. So again, please reach out to me if you're interested in working with us. My email address was on the first slide, but just to give it again, it's sjcrowe@purdue.edu. Next slide, please. So Eric Evans and Sherry Steiner talked about this at the very beginning. So in the interest of time, I'll just kind of skip over this. So my boss at Chucky is Dr. Jasmine Gonzalvo and is partnering with Eric Evans and Sherry Steiner for the environmental health assessment. So we could skip through this slide. And so the last thing I wanted to talk about is a request for grant proposals that we have coming soon. And there's not a slide on this, but I wanted to mention this is brand new news, hot off the press, and still hasn't been finalized. But we have a request for proposals coming soon. The goal of that proposal is to reduce health inequities within the community. And so eligibility criteria, so these will be $15,000 grants offered to communities like Blackford County and throughout Indiana. Eligibility includes free clinics or federally qualified health centers within Indiana, substance abuse treatment facilities, mental health centers, nonprofit clinics, or just community-based organizations in general. So the proposal is going to be short. It'll be less than 1,000 words total. And the goal, again, is to reduce health inequities within the community. Preferences will be given to projects that improve delivery of and access to healthcare, build sustainable models for healthcare delivery, reduce health disparities among minority populations, impact the social determinants of health, which could include anything from transportation, housing, access to healthy foods, improvement of air or water quality, and a host of other things. So if you're interested in applying and have some questions about that, please again, reach out to me about this. And we're hoping within the next week or two, we'll have this available, the request for proposals available to send out to everyone. The deadline for that will probably be January 31st, 2022, with the notifications being given by the end of February. And so that funding will be for a year. So please consider applying and reach out again if you have any questions about it. And with that, I'll wrap up. Thank you so much for the opportunity to speak.
Hi, everyone. I'm next up on the list, I think. Karen, are we set? Okay, great. I'm John Disher. I am the Director of Community Outreach for IU Health's East Central region, and I have the fortune of working with our leadership of each of our 3 hospitals, Ball, Blackford, and Jay, to develop community collaborations and partnerships that directly affect the health and well-being of the communities we serve. And one of those projects that I'm here to talk about today is the Healthy Community Alliance of East Central Indiana. Next slide, please. The Healthy Community Alliance was developed with a real simple goal in mind, but a very difficult goal, obviously, and that is to improve the health of the population in East Central Indiana and lessen the impact of chronic disease, those things that we've been hearing about today. Next slide, please. Our model is data-driven. The Healthy Community Alliance was born out of what we call a community health needs assessment, and all not-for-profit hospitals, including IU Health Blackford in Hartford City, have to do a community health needs assessment every 3 years. And those are very valuable tools. We actually just finished one up, and we'll be posting that publicly and sending it out. Many of you on the call or in the room today were part of some of our community focus groups. So we'll be sending out copies of that to you. But the best part of the community health needs assessment is not so much the document, it's the action afterwards to address those needs that we find. And so the community health needs assessment was driven out of a desire to, on a broader scale, address chronic disease states in our communities. So we're doing that through working with community partners to increase physical activity, improve nutrition, and reduce tobacco use. The components of our Healthy Community Alliance Health Coalition are, we have a steering committee that's made up of individuals from Jay, Blackford, and Delaware counties. We have 150 community organizations from each of those 3 counties. And we have work groups around our priority areas, physical activity, nutrition, tobacco, in each of our communities. IU Health Ball, Blackford, and Jay serves as the backbone organization. And we have a very robust website with data, health data about the communities that we're assisting. Next slide, please. So one of the concepts I'd like to briefly describe that is really the kind of the heart of the Health Community Alliance is collective impact. And this was defined back in about 10 years ago by Kanya and Kramer, and they basically stated that collective impact is the commitment of a group of important actors. And that's all the folks that are in the room today and on the call from different sectors towards a common agenda for solving a specific social problem using a structured form of collaboration. And that structured form of collaboration includes a common agenda, sharing measurement with each other. Been doing a lot of that today. Something called mutually reinforcing activities, which I'll talk about a little bit later, continuous communication, and having a backbone organization, in our case, IU Health, to keep us moving. Next slide, please. The other concept that we rely on to make our Healthy Community Alliance really work is the sphere of influence. And if you go to Wikipedia and look it up, it's going to say that the sphere of influence is an area or region over which a state or organization has significant cultural, economic, military, or political influence. In our collective impact model, with our 150 partner organizations in 3 counties, we look at a sphere of influence as the ability of each of our partners to persuade folks that they have influence over to make good decisions about nutrition, physical activity, and tobacco use. Next slide, please. So at the end of the day, our collective impact is all about influencing people where they gather and have trust, influencing folks around shared goals in ways that are appropriate for that organization's core mission. We help our organizations use consistent and continuous messaging. And then each organization has a specific type of expertise or ability, and those are leveraged as part of the whole, as part of these mutually reinforcing activities that we participate in. In Blackford County, we're very fortunate. We have 14 partner organizations and over 60 plus contacts from those organizations and other parts of the community that help us with this collective impact and these influencing activities. We've got numerous activities in place, and the Healthy Community Alliance shares resources with our organizations, which they in then turn can share with their audiences. And when I talk about an audience, what I'm talking about is if you're a school, your faculty and your students are your audience. If you're a factory, your workers and your management are your audience. One of our partners in Delaware County is a laundromat, and you'd be surprised at how much the attendant at that laundromat can influence those customers that come in the laundromat when they're equipped with the right sorts of tools and the timing is right. They don't have to be specially trained. It's really amazing to see this collective impact in action. Next slide, please. So really where the magic happens is what I like to say is with our work groups. And we have a work group in Hartford City, or I should say it's for Blackford County. And we work on physical activity, nutrition and food access, and tobacco prevention and cessation. We also have a similar work group in Jay County and work groups in Delaware County as well. But essentially what our work groups do is bring partners together that are able to participate, and we help work on tactics and strategies for them to use to influence their audiences to make those good decisions about what to eat, how to move, and not use tobacco. We look for ideas where we can share resources. We look at ways where partners can come together with those mutually reinforcing activities that collectively add value to our work. We talk about some of our measurements and goals, and then we work on special projects as well. Next slide, please. So what does collaboration and collective impact look like as part of the Blackford work group? Well, the slide on the left is a picture of the story walk that's on the Blackford Greenway. And that was a great example of when our partners came together and we said, what would it look like if we could influence more community members or members of each of our audiences of our respective organizations to utilize the Blackford Greenway more often? What would that look like? And one of the ideas that we came up with to get to that desired state of increased usage was to bring some partners together to create a story walk. So about a quarter mile of the Blackford Greenway has a story walk that encourages families to come out and utilize the trail. Our group has also gotten together and worked with local schools to talk about wellness, community development, and different types of programming around nutrition and tobacco and vaping. Partners have also come together to fund local projects, including fresh free produce and supportive projects on the Greenway. We work together with community partners to create a change tool, which is to identify policy systems and environmental strengths and areas to improve, and use that as a tool for us as we continue to collaborate and share best practices and resources. Next slide, please. So if you're an organization in Blackford County and you are not part of the Healthy Community Alliance, I would like to invite you to be a part of our group. It's absolutely free. Once you get enrolled, you become a recipient of e-news updates about what we're working on, what our partners are working on, some of the tactics that may be taking place, meeting announcement, et cetera. And you're certainly, anybody is welcome to join in what I call the magic at our work group discussions. We meet the second Fridays at noon on odd numbered months. And currently we're using a virtual format. So we encourage folks from around the area to hop online and join us. In January, we'll be doing some goal planning for 2022. So it'll be a great meeting to get started with us if you've not been in the past. So again, my contact information is here. If you'd like to get involved or engaged, please email me and we'll get you started. Thanks so much.
Kathy Ray. Source.
Do we have anybody from Q-Source with us today? Okay, I will quickly try to cover a little bit of the Q-Source. So Q-Source has regional teams across the state, and there's a map. Oh, I'm sorry, they operate in 12 states. Here's a map of that. They work primarily with the Medicare population. However, they are open to working with lots of community partners. And some of you in the room may know this better than I do. These are some of their focus areas: substance misuse, opioids, chronic disease management, care transitions, emergency preparedness, immunization. So you can see why they would want to have lots of different community partners. It's pretty broad. These are some of the participants in their local coalitions that they have. The regional one for this area is led by Kathy Ray, and her contact information is at the end of this. This is the map of some of the regions that they have. You can see the gold section there is where Blackford County is. So there are other counties that are within that region and in that coalition together. They don't cover the whole state. Sometimes that's a question. The white counties are some of the areas I know they're exploring. I think they might be covering a few more, but right now these are the areas that they cover. And this is Kathy's contact information. She will give you a lot more information than I can give you. I have been a part of some of the coalition meetings, but she is a wealth of resource. She has access to all kinds of online tools as well. I know they do a lot of trainings and they do a lot of podcasts. We've had some folks, coalition members, and some of our own team members have participated in some podcasts related to health and wellness as well. So get in touch with her if you're interested in that regional coalition. And then next, I want to take a minute. Sorry, we had a lot of complications in the beginning, and so I neglected to say thank you for hosting us. We are at the Invitation Center right now, and it is lovely. I love all the colorful graphics on the walls. It's a lovely, lovely location. So thank you for hosting us. I'm going to turn it over to you.
Thanks, everyone. My name is Eric Hayes, and I'm one of a number of co-directors of the Invitation Program, who I will introduce you to here shortly. A little background of the Invitation Program. We started in 2017-ish planning this kind of chronic disease treatment prevention lifestyle program. We have a location in Upland in the back of what used to be the Upland Health and Diagnostic Center. I don't know what it's called now. What do you actually call it? Okay, so the Upland Physician Office, there is space in the back of that. And yeah, and we have a facility there you can see in the top left corner. And then in August, thanks to a grant from Eli Lilly, we were able to expand and open a facility here in Hartford City. So for those of you on Zoom, we're located in the old Bureau of Motor Vehicles. And you can see the storefront there in our space. We had the grand opening in August. We were seeing about less than 15 patients in the spring, kind of post-COVID as we reopened, and we're now up to about 40 to 45 patients a week. So we're growing and we're grateful for that. The program basically takes faculty from Taylor and we train students that are interested in healthcare. So pre-med students, pre-PA, pre-PT, pre-nursing, you name it. We train them. And so one of my colleagues, Diane Dungan, is here in the room on the back today. Her background is health psychology. And then Brad Kendall's background is exercise physiology and neuroscience. We do some work with folks who are interested in fall prevention and cognition. So that's part of it. And then our recent hire is Scott Fenstermacher, who was a former Taylor student who is back now. And he's a licensed physical therapist, is doing some PRN stuff for IU Health. So we're trying to just build relationship there. And he is one of the faculty supervisors for the program as well. So students are trained basically for a 15, 16-week semester long class. And then we let them loose, so to speak, with the patients. Sorry, yeah, that's right. We're good. My animations didn't. This is supposed to say who can come. Oh, you're different up there than I am here. That's what's confusing. Yeah, you got, no, you're good. Yeah, who can come? Anyone at risk. Sorry, I'm looking at two different screens for those of you on Zoom and completely confused me. Who can come? Anyone at risk for chronic disease or just wants to get better. It was started as a diabetes prevention program because with the health network we were working with, they identified type 2 diabetes as this most significant health issue in their community. Obviously, type 2 diabetes is everywhere. But the same things that cause type 2 diabetes cause every other chronic health condition out there. So we're trying to get away a little bit from pigeonholing it into just a diabetes prevention program to really this is for anybody who just wants to be well. Naturally, we work with a lot of older adults because chronic disease accumulates over the lifespan. But the truth is we've had some folks, 23, Diane is maybe our youngest. Actually, we got 22-year-old now, don't we? The college students, 19-year-old. So yeah, we're willing to work with anybody who just wants to become healthier. How does it work? Currently, it works by getting a referral from a primary care provider that says you are safe to participate in the program. Patient will show up and do a basic intake where we interview them and ask them questions, get to know them. They'll fill out some surveys so we can kind of tailor the program to meet their needs. They'll do a functional test. So these are things like a timed up and go or 6-minute walk test or a 4-square step test, things that are kind of commonplace in the therapy world to get that way helps us kind of understand their functional level. And then each week we'll ask them to come 2 times a week for a 45-minute session, and that will have an educational component to it as well as a supervised exercise program with it. Cost is $5 per session if they can afford it. If they can't afford it, we don't ask them to pay, and they can bring a spouse or friend for free. Ideally, we're open about 43 weeks out of the year. We close for a couple college breaks and things like that, but we're open about 43 weeks out of the year. So if somebody came all the time, they'd get as many as like 80, 86 sessions in a year, which is pretty intensive in terms of a program like this. Who we're working with right now is primarily IU Health physicians here in Blackford, thanks to Dave and the good work over there. They are letting our students shadow physicians over at the offices. Basically, we were in that physicians forget that we exist and they just don't do a good job of referring patients. And so we said, well, what if we put the students in the office and that way there's a reminder and the physicians, when they don't have time to explain the program, can just hand them off to our students. So we've started that, slowly growing. And then we also work with Jennifer Clam from Reliant Healthcare just next door. We have good partnership there. Other things that are going on, we received an in-house grant from IU Health, kind of, is it Ball Blackford J? How's that?
It's part of our IU Health Foundation.
Okay, the IU Health Foundation, kind of an in-house grant to partner with their paramed home healthcare program. So starting in January, our students will be traveling with their paramedics doing home healthcare visits here in Blackford County. And we'll be delivering basically a hybrid cardiopulmonary rehab program in-home with the intent then of recruiting those patients either back into cardiac rehab proper at IU Health, or if they graduated from that, into the invitation program. The idea here is that it reduces hospital readmissions, which of course healthcare wants to reduce hospital readmissions. So that's coming in January. We also received last year a $15,000 grant from the Indiana Department of Health to pursue becoming a credentialed CDC diabetes prevention program provider. That's a mouthful. We already deliver that curriculum. We've already reached step 1 in that process, and they liked what we did so much that without asking, they gave us another $10,000 grant to keep going. So hopefully within about a year, we'll have the official designation as a CDC DPP provider, which then allows us to get a Medicare number, which then allows us to bill for services, which makes almost no money, but it starts to cover our costs, which is all we're trying to do. And then because of that connection and some other connections with the CTSI, actually, they connect us with the United Department of Health for a new program in the state. We will be one of 3 programs in the state piloting a Heart Healthy Ambassador program, and they gave us a $10,000 grant to do that as well. So I haven't even told you about that yet, but we need to let your providers know that we want to have them start sending us all their blood pressure issue patients as well, because we'll be doing that Heart Healthy Ambassador program as well.
Wow.
So that is where we are to date.
All right, Autumn, it's all you.
So my name is Autumn Roach, and I'm here from the Blackford County Health Department. I'm actually representing our Blackford County Client Consultation Board. I'm here for the Regional Director, Jason Craig, and we're going to just give you an idea kind of what we've been doing, what we are. So the Blackford County Client Consultation Board is a local meeting of individuals that have an interest in substance misuse prevention or mental health promotion. So anyone is welcome to join the conversation. We work to discuss systems in Blackford County that may lead to substance misuse or mental health issues and address those gaps and concerns. We currently have been working on a community resource guide with help from Taylor University. We have updated and distributed a community resource guide. So if you would like a copy, please let us know. We can get you a paper or a digital copy. We are working on an online version and a QR code. So, well, we have the QR code at least for the resource. During this, we also had created a community survey. The survey was to help us to identify some concerns and knowledge from the community that pertains to resources, prevention, and substance misuse. This is just a graph showing, we ask on our survey if anyone in the community knows or had sought mental health assistance themselves. So the responses that we got were that 80.7% do know someone close to them or had sought mental health assistance themselves, 18.4% no. We also asked, or about half of those respondents ever know someone who has sought out substance misuse services. So, anyone? Oh, no, that's okay. Yeah, 3/4 of those respondents state like they felt the need for mental health assistance. No, 3/4 of the respondents state they feel like they, I think we updated that slide. Maybe you didn't get our updated version.
Oh, maybe not.
Do you currently feel like you need mental health assistance? And 73.7% said no, they did not feel like they needed that. So we also asked what environmental obstacles exist in the community that may lead to a substance misuse and or a mental health issue. So as you can see, economics, there were about 20 responses, lack of resources, 26 lack of activities, lack of education, lack of knowledge, and there were some other responses. Didn't get into those. We asked what mental health promotion or substance misuse prevention services are you aware of in the community? So it did look like we got 37 responses saying that people were not aware. 39, the majority were aware of Hester Hollis. There were some others in there, the Hope House, Blackford Mental Health Association. So we also asked, what do you feel is needed in the community that can support mental health promotion and substance misuse prevention services? And as you can see, the majority of the responses were more or better mental health services. It's like awareness and stigma was just beneath that. Education, community supports. Of course, everybody will get a copy of these slides as well, I'm sure. Some of the future projects that we are working on, we're working on a mentorship program. So we've started discussing about creating a youth mentorship program in Blackford County, educating community partners on the services that are available in the county, and continuing partnering with the community to address substance misuse prevention and mental health promotion. So we would love to have you as part of the conversation if you are interested. The Blackford County Client Consultation Board meets the second Thursday of each month, and we had been meeting at the Lighthouse Church.
Next one's what?
I
January
was gonna
12th?
say the next one is January, is it 13th?
Whatever that Thursday is, 12, 13.
Maybe. I'm not quite sure. It'll be the second Thursday in January. We have Jason's email if you would like to get added to that, or you can just show up at the Lighthouse Church. 13th. Yep, thank you.
Beautiful.
January 13th, Lighthouse Church, 10 a.m. That's all I have. Any questions?
Okay, thank you everyone for sharing, all the presenters. We're glad that you were able to join us today. Would like to provide a little bit of time for those of you who are here in person. If you want to connect with somebody, feel free to do that. As I mentioned, this has been recorded. So we're gonna share not only the videos so you can review them or share them if you would like to, but we'll share the slides as well. So you have that contact information if you'd like to get involved or reach out to someone for more information. So we really, 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 really strongly encourage you to consider where you might fit. And if it's multiple places, that's fantastic. Just so that we have as much communication and participation from the community. A lot of times people in the community or public health field think we know what will work with the community, and then it doesn't work because we don't have that community input. So it's very, very valuable to have lots of people join and participate in those groups to help make decisions and decide, you know, what's going to work, what might work, what's something to at least try. So thanks for being here today. Does anybody have any other questions for the group? We have time here. We have another half hour if you care to share anything else or have questions. Anybody online have questions?
Karen, I want to thank you and Connections in Health. They have brought a lot of resources to this community, a lot of networking power that we didn't have. They've connected us with some outside resources that have also brought some funding and opportunities that we'd have never connected with. So it's a really great partnership. And everybody here, whether you know directly that you've benefited, I think we've all indirectly benefited. So thank you.
That's great. We're happy to be here.
Yes.
Thank you. All right. Well, thanks everybody for being here, and enjoy the sunshine today and the weather this week. Who gets this in December, right?
We brought that back from Florida. We were there
Awesome.
last
Thank
week.
you. Thank you, Sherry. Bye, everybody online. Have a great day.